Hello, welcome to another episode of Arthritis and You, A Joint Journey. Today, we've got something special lined up, so buckle up because it's time for the deep dive. Let's give a warm welcome to our hosts, Arthur and Sarah.
Think about what keeps you moving, what keeps your heart beating, what allows you to even think. Often the answers lie in these really fundamental building blocks of our biology.
Absolutely.
Today, we're plunging into the world of calcium and vitamin D. Two nutrients we all think we understand, maybe.
Right. The basics seem simple.
Exactly, but their true impact on our bones, sure, but also muscles, nerves, even our immune system. It's way more intricate.
It really is surprisingly complex when you dig in.
Yeah, more surprising than most people realize. So we're going beyond the basics today. We're drawing insights from the experts at Alberta Rheumatology.
Good source. They cover a lot.
They do. Everything from their detailed website info to their YouTube discussions. The goal: equip you with the critical knowledge that really matters.
Especially if you're navigating chronic conditions or, complex medications. That context is key.
Definitely. So, okay, we know calcium is crucial for strong bones. Let's kick off there. But what else is this powerhouse mineral doing?
Well, it's truly more than just a bone builder, isn't it?
Seems like it.
It's just foundational. I mean, yes, it's essential for bones and teeth.
Yeah.
Holds about, 99% of our body's calcium right there?
99%.
Yeah. But its role goes way beyond that structure. We're talking critical functions like muscle contraction.
Including the heart.
Including the rhythmic beating of your heart, absolutely. And the whole blood clotting system, stopping us from bleeding out.
Right.
And even the electrical signals in your nerves, the ones that let you think and feel.
Okay, so without enough calcium, these really vital systems just slow down or stop.
It simply can't operate properly, yeah.
That's incredible. Muscle function, blood clotting, nerve signals. Was there one of those functions that surprised you most when you first started digging into calcium?
That's a good question. I think, maybe?
Yeah.
The messenger role?
Messenger.
Yeah, how it's not just structure, it's active in communication between cells. That's often overlooked.
Yeah.
And something that often trips people up, a common misconception, is about supplements.
Right. You grab a bottle.
Exactly.
Yeah.
You see a number, say 1,000 milligram, and assume that's what you're getting. But here's that deep dive insight. The elemental calcium.
Elemental calcium. Okay, why does that word change everything? Unpack that a bit.
Right. Think of it like you're not just buying the whole package, you're buying the pure stuff inside.
Okay.
Calcium comes in different salt forms, like calcium carbonate, calcium citrate, common ones. And each gives you a different amount of that pure, usable elemental calcium.
So the percentage is different.
Totally different. Calcium carbonate, for example, it's about 40% elemental calcium.
40%.
Yeah. So that 1,000 milligram tablet, it's actually giving you 400 milligrams of usable calcium.
Okay, big difference.
Huge.
Yep.
And calcium citrate, that's only about 21% elemental.
Wow, okay.
So this difference really affects how much your body can actually absorb and use. It's a game changer if you're trying to hit specific daily targets.
That distinction, elemental calcium, it's vital. But what does it actually mean for your daily plate and maybe the supplements you're thinking about? How much do we really need?
Good question.
And how should we take it to, get the most out of it, maximize absorption?
Okay, so Health Canada, their recommendation for healthy adults is somewhere between 1,000 to 1,200 milligrams.
Total daily.
Total daily calcium, yeah. From your diet and any supplements combined.
And that depends on age, right? Pregnancy.
Exactly. Age and pregnancy status adjust that a bit.
Yeah.
And it's worth knowing. The typical North American diet
Yeah, probably not enough.
often only gives you about 250 to 300 milligrams a day from foods that aren't dairy or fortified.
Right, so supplements often become necessary.
Very often. Now, here's a crucial point for actually taking supplements effectively. Your body can only absorb about 500 milligrams of calcium at one time.
Only 500 milligrams. So if I need 1,000 milligrams.
You absolutely have to split the dose. Take 500 milligrams twice a day. Don't take it all at once.
Okay, that's a really practical tip. What about food? Does it matter if you take it with meals?
It depends on the type. Remember calcium carbonate?
Yeah.
The 40% one?
Yeah.
That one needs to be taken with food. Needs stomach acid to break down properly.
Ah, okay.
But the other salts, like citrate, chloride, acetate, those are more flexible. You can take them with or without food.
Good to know. And for finding good food sources.
The Dietitians of Canada website is fantastic. Really great resource for that.
Okay, great. So given how crucial calcium is for everyone, What about for someone navigating, say, rheumatoid arthritis? Does its importance get amplified?
Yeah, that's a really vital question for a lot of people.
What's happening in their bodies that makes calcium and presumably vitamin D even more critical?
Well, patients with these rheumatic inflammatory conditions, they often experience faster bone loss,
Yeah.
just quicker than the natural aging process.
Which leads to...
Unfortunately, it can lead to osteoporosis and a higher risk of fractures.
Right.
And then, to complicate things, some of the medicines used to treat these conditions.
Like prednisone.
Prednisone's the big one, yeah. It can actually reduce bone strength even further.
Double whammy.
Exactly. So yes, getting enough calcium, specifically around that 1,200 milligram mark, becomes absolutely essential to help maintain healthy bones.
And how does it work in that context?
It works by getting absorbed from your digestive tract, and this is key, with the indispensable help of vitamin D,
Ah, the partner.
the partner. Then it becomes available to the cells that maintain and repair your bones, all while supporting those other functions we talked about, like muscles and nerves.
Okay. Calcium, powerful, but rarely works alone. Needs that crucial partner, like you said. The key that unlocks its potential, let's shine a light there. Vitamin D.
The sunshine vitamin.
Right. But what exactly is it beyond the nickname, and why is it so vital to this calcium relationship?
So vitamin D is a fat-soluble vitamin, and it's unique because your body can actually make it.
From the sun, yeah?
Yep. When sunlight hits your skin, it produces an inactive form called vitamin D3, cholecalciferol.
D3, that's what's
Yeah.
usually in supplements.
That's typically what you find over the counter, yes. Then your body acts like a little factory,
Yeah.
sends that D3 to the liver, then the kidneys, to transform it into the active form, calcitriol. That's the version that actually does the work, regulating calcium and phosphorus.
Okay, active form calcitriol. Got it. What about vitamin D2? I've heard of it.
Right, D2,
Huh.
ergocalciferol.
Right.
That mainly comes from plant sources. You can also find it in like egg yolks, fatty fish, salmon, tuna, and fortified foods.
Okay.
In Canada, though, vitamin D2 is actually prescription only,
Oh, really? Why is that?
often used in specific medical cases. It has a slightly different metabolic pathway, how the body processes it.
Interesting. Okay, so if D3 is the raw material and our bodies make it from the sun, how much do we really need?
Yeah.
And can we realistically get enough just from sunlight, especially, living in Canada where winter is? Well, winter.
Yeah. Sun deprived is putting it mildly sometimes.
Right.
So Health Canada recommends 600 to 800 units IU daily for adults with minimal sun exposure.
600 to 800.
Yeah. And while, sure, a few minutes of sun on your face, arms, hands can help your body produce some vitamin D.
Yeah.
But it's still really crucial to wear sunscreen, avoid prolonged UV exposure. Skin cancer risk is real.
Absolutely.
And yes, in Canada, especially during those darker fall and winter months, relying only on the sun often just isn't enough.
So supplementation becomes important again.
Often necessary, yeah. And just like with calcium, Osteoporosis Canada has excellent lists of common foods that are rich in vitamin D. Worth checking out.
Good tip. So for our listeners dealing with rheumatic conditions, we know calcium's role is amplified. How does vitamin D fit into that picture, especially thinking about those medications like prednisone?
Right, connecting it back. Vitamin D becomes even more critical here.
Why specifically?
Well, we already mentioned the faster bone loss these patients can experience.
Yeah.
Plus, those medications like prednisone and even methotrexate sometimes, they don't just weaken bone directly. They can actually lower vitamin D levels in the body.
Oh, wow. Okay, so it affects the vitamin itself.
It can, yeah. So having adequate vitamin D is just essential to maintain healthy bone density in these situations.
And its main job is helping calcium absorption.
That's its primary mechanism, precisely. Regulating calcium absorption from your digestive system, making sure that calcium actually gets into your body to do its job.
Okay.
And it also plays a big role in maintaining the right bone structure by regulating both calcium and phosphorus levels. It's a balancing act.
Okay. We've explored calcium on its own, vitamin D on its own, but you mentioned the synergy, the partnership. That's where the real power often lies, right?
Absolutely. Teamwork makes the dream work, even at a nutrient level.
So when these two work together, what do the studies actually tell us? Does the science translate into real-world benefits, tangible protection for our health?
It really does seem to. For calcium, the studies suggest that getting enough daily, whether just calcium or, better yet, combined with vitamin D, can significantly reduce the risk of osteoporosis.
And fractures.
And prevent fractures, yes.
Yeah.
Particularly noted in men, and especially in postmenopausal women.
How much does it help?
Well, it's been shown to slow down that rate of bone loss in postmenopausal women from maybe 2% a year down to something like 0.25% to 1%.
That's quite a reduction.
It is significant.
Yeah.
So if your diet's falling short, supplementing really is a critical step.
Okay. And for vitamin D, when it's taken with calcium?
The studies there are also quite clear. Taken together, they reduce the risk of osteoporosis, fractures, and that loss of bone mineral density. Again, especially noticeable in postmenopausal women.
So organizations like Osteoporosis Canada recommend both.
Yes, they recommend both calcium and vitamin D as part of osteoporosis treatment. An adjunct.
But not the only treatment.
Crucially, no.
Yeah.
They shouldn't be the sole treatment. They're part of a bigger picture.
The synergy sounds incredibly important, especially, let's circle back, for patients on corticosteroids. Prednisone again, we know it impacts bone strength.
Right.
So what do the recommendations say for this specific group? How much calcium and D do they need?
This is exactly where that synergy becomes just vital. Studies specifically in patients with rheumatic conditions taking steroids, they consistently show that getting enough calcium,
How much is enough in this case?
usually aiming for 1,200 to 1,500 milligrams per day,
Okay.
and vitamin D supplementation around 800 to 1,000 units or IU per day.
Right.
Taking those amounts significantly reduces that steroid-associated bone loss and the risk of developing osteoporosis.
And that's backed by major groups.
Yes, the American College of Rheumatology specifically recommends those ranges for patients on corticosteroids. It's standard guidance.
Okay. Now, is standard vitamin D3 enough, or are there other forms sometimes used? You mentioned D2 earlier.
Good question. Standard D3 is effective, yes. But some studies hint that something called alpha-calcityl.
Alpha-calcityl, what's that?
It's a specialized form of vitamin D. It's basically already activated.
Ah, like the calcitriol you mentioned.
Sort of. It bypasses some of the body's conversion steps in the kidney.
And why would that be better?
Well, some studies suggest it might be even more effective, particularly at preserving bone mineral density and reducing vertebral spine fractures.
But there's a catch.
There usually is. Because it's more potent and bypasses some regulation, it also carries higher risks, particularly of high calcium levels, and it costs more. So it's definitely not for everyone, requires prescription and careful monitoring.
Makes sense. And sometimes, even with calcium and D, it's not enough. Other meds might be needed.
Exactly. Especially if there's already significant bone loss or the risk is very high. Stronger medications, like bisphosphonates.
Those are the ones that slow bone breakdown.
Precisely. They might be added to the plan either for prevention or treatment of steroid-induced osteoporosis or just general osteoporosis.
Okay. With all these proven benefits for calcium and D, it's easy to think more is better. Load up.
Right, the common assumption.
But what about potential downsides? Are there things we need to be careful about when taking these supplements? Side effects.
Absolutely crucial to consider that, always. For calcium, if you stay within the recommended daily dose, it's generally tolerated pretty well.
But some people might have issues.
Some people might get stomach-related things, constipation, maybe some discomfort, nausea, belching, gas, that kind of stuff.
Okay. Anything more serious?
It can worsen certain types of kidney stones if you're already predisposed. That's something to discuss with your doctor if you have a history.
Right. And vitamin D side effects there.
Again, generally well tolerated orally within the recommended doses. There's an upper tolerable limit set, around 4,000 units a day for adults.
So don't go over 4,000 IU.
Definitely not without medical supervision, because taking excess vitamin D way too much can lead to hypercalcemia.
Hypercalcemia. Too much calcium in the blood.
Exactly. And that's dangerous. It can cause serious problems. Kidney damage, seizures, even hardening of your arteries because calcium starts depositing where it shouldn't.
Yikes. Okay.
It's a particular worry for patients who already have kidney failure or maybe high levels of parathyroid hormone, conditions that already affect calcium balance.
Got it. Now this next point. This is a genuine headline insight, something that's caused a lot of buzz.
I think I know where you're going.
The heart-health connection. While calcium is vital, some studies, some research suggests high-dose calcium supplements might pose a cardiovascular risk.
Yes.
Is this a reason to ditch our supplements entirely, or is there a really crucial nuance here?
There is a critical nuance, and it's often misunderstood. So, yes, some research has raised concerns about a possible increased risk of heart attacks linked to higher doses of supplemental calcium.
How high are we talking?
Typically looking at that upper range, like 1,200 to 1,500 milligrams daily from supplements.
Okay. But is the evidence conclusive?
It's important to stress that more data is still needed.
Mm.
Research is ongoing to really nail down this risk. It's not a closed case.
Right.
But here is the crucial distinction. Calcium you get from food, your dairy, your fortified foods, leafy greens.
Yeah.
That does not appear to carry this same potential risk.
So it's about the source, supplements versus food?
It seems to be, based on current understanding. So the takeaway isn't fear calcium. It's prioritize getting it from your diet as much as possible.
And if you do need high-dose supplements...
Talk to your doctor. Always. Discuss the risks and benefits for your specific situation.
That's a really vital distinction. Okay, beyond heart health, are there other important drug interactions or disease interactions we need to know about with either calcium or vitamin D?
Absolutely. Interactions are a big deal with supplements. Calcium salts, for instance, can actually lower the effect of some medications.
How does that happen?
They can bind to the medication right there in your digestive tract and just reduce how much of the drug gets absorbed.
Okay, so the drug doesn't work as well. What kinds of meds are we talking about?
Common examples include levothyroxine, that's for thyroid,
Right.
digoxin for heart failure, certain antibiotics like tetracyclines or fluoroquinolones.
Wow, common ones.
Yeah. Iron salts, too. And even some of those bone-building meds we mentioned, like bisphosphonates.
So what's the solution? Just stop taking calcium if you're on those meds.
No, not usually.
Hmm.
The key is timing. It's incredibly important to tell your pharmacist you're taking calcium.
Why the pharmacist specifically?
They're experts on this.
Yep.
They can advise you exactly how to manage it, usually by spacing out the doses. Taking the calcium several hours apart from the other medication.
Okay, spacing is key. Got it. Any other calcium interactions?
One more important one.
Yeah.
If you're taking meds that lower stomach acid,
Hmm.
think ranitidine, omeprazole, those PPIs.
Yeah, lots of people take those.
Right. Remember how calcium carbonate needs stomach acid?
Yes.
Well, those meds reduce the acid, so the absorption of carbonate will be lower. In that case, calcium citrate would be a much better choice, since it doesn't rely on stomach acid.
That makes perfect sense. Good tip. Okay, what about vitamin D interactions? Similar concerns?
For vitamin D, yes. Mainly if you take those very high doses that cause hypercalcemia, that high blood calcium.
Yep.
That high calcium level can actually reduce how well some calcium channel blockers work. Those are heart meds, like diltiazem, verapamil.
Okay.
And it can even increase the risk of digoxin toxicity, another heart drug.
So people on those specific heart meds need extra caution.
Definitely. They should be particularly careful not to go over, say, 2,000 units of vitamin D3 per day without talking to their doctor.
Okay. And what about people already at risk for high calcium, like with kidney issues?
Right. Patients already at increased risk, like with renal failure or hyperparathyroidism, vitamin D supplementation should only really be used with extreme caution, always under strict medical supervision. They need close monitoring.
Makes sense. So bringing this all together, we've covered a lot of ground. What's the ultimate takeaway for us as listeners trying to navigate this?
The absolute bottom line. Always tell your doctor and your pharmacist about any supplements you take, even natural ones like calcium and vitamin D.
They need the full picture.
They need the full picture. They are your best resource for personalized advice, especially about these crucial interactions and finding the right dose for you.
Right.
And remember, while calcium and vitamin D are incredibly important, they shouldn't be used as the only treatment for complex conditions like osteoporosis. They're part of a bigger plan.
Okay. So we have taken quite the deep dive today into calcium and vitamin D. We've uncovered their vital roles, bone health, sure, but also muscles, nerves, blood clotting.
Right, the whole system.
And how they uniquely support people navigating rheumatic conditions. We've explored recommended intakes, the whole elemental calcium thing, how different forms affect absorption.
And that powerful synergy between the two, especially when things like corticosteroids are involved.
Definitely. And we also navigated those really important considerations. Side effects, that critical distinction about calcium sources and heart health and those drug interactions.
Indeed.
Mm-hmm.
It's really been a journey through this intricate dance these two nutrients perform inside us. It highlights how seemingly small details like elemental calcium or where you get your intake from can really impact your whole health strategy.
Yeah. What truly stands out to you from today's deep dive, for me, I think, it's realizing just how precisely our bodies balance these apparently simple compounds to function optimally.
That delicate balance is key.
It really makes you pause and think, doesn't it? How does understanding this intricate dance, this balance of just a mineral or a vitamin, how does that change the way you approach your own health and well-being? Knowing that even subtle imbalances can have these massive ripples across your entire physiological landscape, something to chew on.
This has been another episode of Arthritis and You, A Joint Journey, brought to you by the Rheum team from AlbertaRheumatology.com, your trusted evidence-based suite of resources available 24/7. Straight from Alberta, but for folks around the world. Our hosts today, Arthritis and Sarah Upis, technical producer, John Ifund, and our executive producer, Stephen Cates. While we work hard to maintain the accuracy of our information, we accept no legal responsibility for any errors or omissions. Remember, always check with your own physician first. Join us next time for another Deep Dive.